And we begin this hour with some breaking news out of Alberta. The province confirming its first death this year due to measles. Nearly 2,000 cases have been confirmed, with more than 150 hospitalizations and more than a dozen ICU admissions. Sam Sampson is on the story, joins us now from Edmonton. What do we know, Sam, about this case?
Well, this is a very sad case, Ian. The province of Alberta has reported that a prematurely born baby has died from the measles. In a statement, the province said that the mother had contracted measles while pregnant and that the baby died shortly after it was born. We also know that while there has been another baby's death in Canada, in Ontario in June from the measles, this is the first child's and baby's death from this virus in a long, long time in the province of Alberta. In a written statement, I should say, the health minister of Alberta said that since measles were first reported in Alberta this spring, I had hoped this moment would not come. She goes on to say, my sincere condolences go to the family during this profoundly difficult time. Now, that statement that we got this afternoon, Ian, also reminds Albertans at risk to be vaccinated and says measles during pregnancy can lead to serious complications, including miscarriage, preterm labor, stillbirth, and congenital infection.
And of course, nothing new about those warnings. Experts in your province have been consistent. Warning about measles, what are they saying today?
Absolutely. And I mean, we've been covering this across the country since the measles outbreaks have been really bad in different provinces. And myself and colleagues here in Alberta have been reaching out to physicians who have seen measles cases, scientists, infectious diseases experts who have specialized in, well, obviously infectious diseases and have understood the real impacts of measles. And they are the ones that we've spoken to today, very concerned, very sad, because this is a child, a baby who has died. And they have urged, since the outbreak started, for Albertans to get vaccinated, especially because measles is such a serious virus and it can kill the vulnerable, including children. But in Alberta particularly, these experts have pushed for more vaccine uptake. They've pushed for things like special vaccine clinics, just stronger outreach in general. This province has not had the best vaccine uptake for the measles vaccines. And Lenora Saxinger, an infectious diseases expert that we spoke with at the University of Alberta earlier today, warns that we have to address whatever barriers still exist for Albertans who have not yet gotten fully vaccinated against the measles, whether that be not as much access, whether they're in more remote or rural areas of Alberta, or if disinformation has swayed their decisions. Take a listen.
When's the last time you heard of a baby in Alberta dying of measles? And you'd be looking really a long, long time ago for that. And in fact, that is because the vaccines are successful and they're safe. And the MMR vaccine has really been the subject of a very extensive smear campaign, essentially, that's really got very, very powerful disinformation behind it. And so I would just urge people to kind of look at it, with the long view, which is we didn't used to have problems like this. This risk to babies can be contained if we actually look at, the true science and the true data around the safety and the effectiveness of these vaccines.
Now, while not a health expert, the provincial NDP's health critic really hammered home on the provincial government today and was vocal about the province's role in the measles outbreak. During a media availability just a couple of hours ago, the health critic said that the province had to take accountability for its role in the measles outbreak. And so I specifically asked the health critic, is she blaming the government, the current provincial government, for this baby's death?
I'm blaming the government for allowing things to get as bad as they are and for the outbreak to have been as terrible as it is. And the government's own website said that death was a possible outcome in about 1 out of 1,000 cases. So the government knew that this was a possible outcome and should have acted a year and a half ago to make sure that we didn't experience the outbreak and that this mom and baby didn't have to be in the situation that they're in today.
In her statement, the provincial health minister, when we learned about this prematurely born baby's death today, did give some straightforward vaccine advice, especially for people who are planning to become pregnant, to say that you should be getting 2 doses of the measles vaccine before conception, and then really just urging vaccination in general. The province also says that it launched an advertisement campaign to get more Albertans vaccinated in the spring, and it claims that vaccination uptake intake has been higher this time compared to this time last year. And of course, everybody we spoke with, Ian, today gave their sincere condolences to this family who is now grieving a baby's death.
Yeah, first and foremost, a tragedy, but the unanimity among infectious disease experts is resounding. It is far safer and more important to get this vaccine than to not get it. Sam Sampson in Edmonton, thank you so much.